Hi folks! So today I want to talk to you about bones of the lower extremities, or in other words, bones of the legs and pelvic girdle. So let's first of all orient ourselves. We just finished talking about bones of the arms and upper extremities. And if you remember, we had a shoulder girdle that was created, a girdle meaning a belt or a ring that was created by the sternum meeting the clavicles, meeting those scapula and humerus, and the scapula did not actually connect in the back, which allowed that free range of motion, that increased range of motion of our shoulders. Our pelvic girdle, on the other hand, is going to form a complete bony ring. This will limit the range of motion of our legs, but provide a little more stability. So we're less likely to dislocate our leg or have our legs go out from under us, but we also probably, most of us can't, for example, throw a baseball with our foot or wrap our leg up over our head. Little less range of motion. So let's look at that pelvic girdle. And here we have a human pelvis. So this is the hips of a human. So the hip girdle is composed of the coxal bones, which have 3 fused bones within them on each side. So we'll talk about those in a minute. So these 2 coxal bones or hip bones, they fuse together in the front. That's the pubic symphysis. This is a cartilaginous joint that provides some strong but slightly flexible connection. It's going to get stretchier, by the way. If you're having a baby, you're going to release some hormones to make that a little stretchier. And then in the back, we have a bone that is part of the vertebral column. This is the sacrum at the base of the vertebrae. And a little bone here in the very back that's often fused. This one may have lost it, but the coxal bone or tailbone. So our hip girdle is these 2 coxal bones and the sacrum in the back. So here's our complete bony ring. So you can see solid ring, less flexibility in what the legs are doing, but a lot of stability. So the 3 bones of each side of the pelvis, each coxal bone, are specifically the ilium, the ischium, and the pubis. And when we fuse them into one fused bone, we call it a coxal bone or a hip bone, or occasionally, if you want to get really fancy, an os coxa, which means coxal bone. So here is a single coxal bone. This one's got some writing on it. And it is fused together from the ilium, the ischium, and the pubis. So before we look at them on here, let's look at them in a sort of color-coded diagram to get a better view of how they are arranged. So here are, is a single hip bone seen from the lateral side, the outer side, and from the medial side, the side more facing inwards towards the middle of the body. And in green, we have our ilium up here, the ilium. Then we have in orange our ischium. And then most central, our pubis, which is forming our pubic region and our pubic symphysis, that cartilaginous joint. So ilium, ischium, pubis. And so we want to, you'll notice they all connect together right here in this dip in the middle. This is the concavity or the cavity, the socket for that hip bone, that femur to sit into, not the hip bone, the thigh bone to sit into. So they all fuse together right in this hip socket. So let's go ahead and run through these one at a time. The biggest And most obvious structures are going to be this socket and this hole. So here's our hips, and we have this socket, which is called the acetabulum, which comes from a phrase meaning acid cup or vinegar cup, and it's a little cup that looks like it's been hollowed out by acid. So the acetabulum is the articulation point where the coxal bone articulates with the head of the femur. So real fast, not to knock anything over here. Femur, nice round head. Now we've got our hip socket. So that's one really big landmark. Our other big landmark is this big hole here. This is the Obturator Foramen. Foramen means hole. So we'll see that word pop up a lot of places in anatomy. Foramina is the plural. And obturator means obscured, and that's because this hole tends to be covered by tendons, ligaments, and muscles. So literally, large hole. So now we have kind of our big structures in place. Let's look at some of these subgroups, starting with the ilium, which forms these wing-like crests at the anterior or top of each pubic bone. And so we have our acetabulum, that tells you which side is lateral. We have our obturator foramen. So this is this bone here. So let's look at this by itself, but now we know how we're oriented in that hip region. So let's look at this. This is the ilium. These form these flared ridges or wings that form the superior region of the pelvic girdle. This is the part that's going to articulate in the back with the sacrum. So you can see in the back that articulation with the sacrum and the ilium. Sacrum, ilium. Here's that flat panel for that articulation point. Have a sacrum over there. These don't fit super nicely together because they're not from the same body. Here we can see. This big wing-like portion we call the ala, and ala literally means wing. You guys know I'm an entomologist by background, bug scientist, and so we say that, for example, ants with wings are called alates. So ala means wing. So this is the wing, the ala. This top ridge is the iliac crest. Iliac from ilium and crest because it's a big kind of ridge sticking up. So here you can see the iliac crest, and on some people you can literally see these ridges of their hip bones, the iliac crests, through their skin or past their muscle. So these are kind of the points or ridges of your hips. That iliac crest, we can then, I'm turned around here. Here we go, here's the back. That iliac crest, we can then find landmarks on by looking for particular spines or points located at different portions of the iliac crest. So let's take a look at these. I think these spines are easiest to find on our full model, and we're going to have basically points located along these wings. We'll have 2 in the front and 2 points in the back for each of them. So in the front, if we follow this crest, we have a point right here. So that's our first point. And then we have a point right here. So these are our 2 front points. This is the anterior, superior iliac spine. Anterior means in the front, superior means on the top. So if you had to guess, this is going to be the anterior, inferior iliac spine. Name makes sense. Anterior, superior, anterior, inferior. if we follow this crest around to the first point in the back, here we go, we're going to have 2 points in the back, and they're going to be located here and here. So we come around, we get a point here and a point here. So these 2 points here. So you can probably guess what they're named. We're not anterior anymore. We are, oh no, I'm pointing, sorry, that's the front again. I've lost track of where we are. We're going to follow this around to the back. Here's our 2 points. That makes more sense. So now we're in the back. I lost track while I'm looking at myself in the video. Now we're in the back. We're in the posterior. So we have the posterior superior spine, posterior superior iliac spine, and the posterior inferior iliac spine. So we got 2 points here, follow it around, 2 points here. And you'll notice that these spines also mark the edges of the crest. The 2 superior spines, the anterior superior spine and the anterior posterior spine, form the edges of each side of the iliac crest. So when you're looking at a single hip, as I said, I always find it a little harder to orient myself to these, but here's our socket. Here's our articulation point with our sacrum. Here's our articulation point in the front for a pubis, and here's our iliac crest. So here we have our front 2 spines, and here we have our back 2 spines. Front 2, back 2. So that's how you can get oriented to what you're looking at. Again, depending on how it's turned, these are very strangely shaped, so it really does help to handle these and practice orienting yourself to what you're looking at in terms of the bone itself. So the last important feature on the ilium that we're going to talk about is the greater sciatic notch. And that is a notch right here. You can see it through here, or if we turn around from the side, here it is. It's right behind these 2 spines in the posterior, and right under that, past that posterior inferior spine, is the greater sciatic notch in the back. Here's the other one. So this greater sciatic notch gets its name because the sciatic nerve is going to pass through it and fit right in that notch through there. And so if it gets pinched, you can have some unpleasant nerve pain from there, but that is our greater sciatic notch. The nerve passes through there and heads down on into the thigh. The last thing I want to say before we step away from these is that what are all these points? Point here, point here, point here, point here, all this. Well, why do these points form? They are places where muscles, tendons, and ligaments are attaching to the bone and pulling. Remember, whenever you see a process or a protrusion on a bone, it usually means something has been attached and pulling on the bone, and the bone has built up in that area. So by the way, here's our bone, getting oriented here, and here is our sciatic notch in the back there. All right, so now that is our ilium, the top part of the bone. Let's look at our ischium. And just a reminder, the ilium was this green part up here. The ischium is this orange part out here. And I like to say the ischium is the sit bone, because this is the part of the pelvis that you sit on. So right here, we have the iliums up here. The pubis is going to be in the front, and this part here is the ischium. And sure enough, this is where you're going to sit. And this is really built up because it's taking the weight from when you sit. So let's look at important structures of the ischium. Again, a separate bone on each side. And our big important structures, the ischial tuberosity, I've referred to this big chunky mass that's really built up on the posterior side of each of these bones. That ischial tuberosity is literally formed by the fact that you sit on it. So it's a site of muscle attachment for your legs. That's also creating the pulling, but it's what you sit on, your ischial tuberosities. And some of you may know if you have a little less padding in your rear ends, you may start really feeling these digging into the hard ground after a while. So ischial tuberosities, let's look at that on here, our single bone. Again, let's get oriented. Here we go. So we've got the side, the front, and here's our ischial tuberosity right here. So our ischial tuberosity, and then the other important feature is going to be the ischial spine. So ischial spine is easiest to see from a posterior view. So we turn us around, here's our ischial tuberosities, and you'll notice here's a little spike right up above. Here's our ischial tuberosity, little spike, that's our ischial spine. You'll notice it's kind of on the other end of that sciatic notch. So we have these two ilial spines, posterior superior, posterior inferior, greater sciatic notch, and we come down here to the ischial spine. The ischial spine is another site of ligament attachment. See if we can find it on this bone. Again, get ourselves oriented. Here's our pubic symphysis, and if we turn it around, there it is, ischial spine. All right, last portion we want to look at is the pubis or pubic bone. Let me share screen for a second. So this is in pink on these two, and it forms the middle front of that pelvic girdle or the pubic region, also known as the genital region. So let's look at it on here. Here's our two pubis or pubic bones on each side, pubis, pubis, and they meet in the front in the pubic symphysis. And that's the only important, well, not the only important, but that's the key feature I want you to know is this joint here is going to be a joint made of fibrocartilage, a big fibrocartilage pad that firmly joins these two together. All right, so that puts our two hip bones in place, our general hip girdle or pelvic girdle. Let's now start looking at some of the bones of the legs. And we will return to talk about the sacrum when we get to the vertebral column. So this bone will come back later. All right, so you may notice right away that there are a lot of structural similarities between our arm bones and our leg bones. Namely, in our arm, we have our humerus, our ulna, our radius, and in our leg, we have our femur, our tibia, and our fibula. So some structural similarities right there. And here we would have our carpals, our metacarpals, and our phalanges. And here we have our tarsals, our metatarsals, and our phalanges. So you already have a big head start in learning these bones of the legs. So let's look at these bones, starting with the femur, which I did show you before. It's so big it almost doesn't want to fit in the screen. And actually, let me find my humerus just to show you a comparison. I'm gonna have to juggle here. Here's our thigh bone, our femur. Here's our humerus. You can see, now this isn't from the same person, so this is especially large for a human femur, but you can see that your thigh bone is the biggest bone in the body. And then your humerus is still pretty big and sturdy, but looks much tinier comparatively. One thing they both have in common, though, is this big round head at the top, which allows for that big ball and socket joint that's so important in our shoulder joint and in our hip joint. So let's take a closer look. I'm gonna have to put this guy out of the way. I know you want to sit in my lap, but you're going to have to move over here. Don't knock anything over, buddy. Stay there. All right. So here's our femur, the largest bone in the body. I feel like you could use this guy as a weapon. And the femoral head, you'll notice one big distinction between the femoral head and the humeral head, or the head of the humerus, is that this one sticks over to the side to get that kind of outward socket of the legs, where they socket into the hips. So again, it's our hip, and we socket in like that. So the femoral head articulates with the acetabulum of the coxal bone. Then we have the femoral neck. And remember, just like with the humerus, that anatomical neck is going to be right here, just distal to the head. It's not down here. That would be more like the surgical neck. This is the anatomical neck. And we're just going to call this the femoral neck. We're not going to worry about those two distinctions. Then we have our greater and lesser trochanters. So remember, on the humerus, we had a greater and lesser tubercle. Here we're going to have a greater and lesser trochanter. So let's take a look at those on a skeleton. And I just set him down. Let me grab him. So one thing you might remember is that on the humerus, the greater and lesser tubercles were really most visible from the back. And same thing here on the leg, the greater and lesser trochanters are going to be most visible from the back. Oops. So here we can see both of them really visibly. And fortunately, they're easy to keep straight because the greater trochanter is up here, the lesser trochanter is smaller, it's down here. So if we look at that over here, this is the front of the femur, the anterior side. Mostly only the greater trochanter is visible. If we look at the posterior side, we can see the greater trochanter and the lesser trochanter. So that's one good way to figure out which side of the bone you're looking at. Now, trochanter, just like tubercle, basically means sticking out bit. Trochanters tend to stick out a little more in a mallet kind of shape, which you can see we have a little more of a projection there on each side, but they're formed by the same thing, which is basically muscle and ligament attachments. You pull on that bone, you get your greater and lesser trochanter. So what's next? Well, I was going to see if we could see it on here. This bone is a little worn away in the front, so we're not going to get a real good view of it, but the Fovea Capitus is another important thing. So since this bone is a little too worn away to see it, let me see if I can find a picture to pull up for you guys. So here's a close-up of the head of a human femur. And you can see that in the head is a divot located inside each head. And here it is still visible, but again, it's so broken off that it's hard to see what you're looking at. So here you can see these divots right here and here. These are the Fovea Capitus. Capitus refers to the head, like decapitate. So fovea means basically divot, like fossa. And what this is a pit in the head of the femur, and it's an entry point for nerves and blood vessels to the interior of the bone, because you do need a blood supply to the inside of this big old bone. You do need nerves getting to the inside of these bones. And we will look at this a little more later, but here's a cutaway of a bone, and you can see we've got that spongy marrow up in the various epiphyses of the bone, and then a hollow shaft that would be full of yellow fatty marrow. Here's where we would make our blood. Here's where we'd store our fat. And this is a great place. This is where a large percentage of the blood in your body gets made. And if you need to give someone a lot of blood quickly and you don't want to spike their blood pressure, you're going to poke a hole right into this femur and start dropping blood directly into the femur. So let's look at another structure Excuse me, my throat's a little dry today. Now we're going to go to the other end of our femur. So again, here's the front of our femur, and we go down. Now we're at the knee side, and we're going to have important joints that are nesting into that. Tibia, which has the fibula alongside it. Those are the equivalent of our ulna and our radius. So let me get my fellow for you, and we'll take a look at that knee joint. And actually, instead of getting my little skeleton, I found my knee model, which is going to be a little more helpful because it'll let us take a really good close-up look at this joint. And this has the femur, the tibia, the fibula, the patella, and various important ligaments. So we're really going to get to see some things going on. So the femur articulates with the tibia, just like that, sitting together. And unlike in the elbow, where the radius is also interacting with the humerus, we're going to have the fibula doing kind of completely separate thing, not really attached to the femur at all. So we'll leave it aside for now. Come back to it later. But just so you can visualize that, here's the fibula doing its own thing down there. So you can see that rather than that really sturdy sort of trochlear notch and trochlea hinge joint of the elbow, we have a kind of a little shallower joint going on here with sort of two surfaces fitting together in grooves to get that articulation of the knee. So we'll talk about the knee joint in more detail in class when we get to joints chapter. But broadly speaking, we have two condyles, and a condyle basically just means a rounded articular or joint surface in this case. And for example, when we say epicondyles, they're to the side of a joint surface, an outer condyle. So we have two condyles, and they are named based on the side of the leg they are on. The medial condyle, so I have to get the femur all in view. The medial condyle is on towards the inside of the body, the inner side of the knee, and the lateral condyle is towards the other side. And these are going to be even more visible from the back of the knee than from the front because they're tucked under there, super visible in the back. And you can see also we have a really distinct, especially from the back, space between these condyles that creates a hollow space inside the knee. That is your intercondylar fossa. Inter means between, so intercondylar, between the condyles. Remember fossa, like fossil, a shallow in the ground. A fossa is a depression, so here's our intercondylar fossa. So the two condyles are large rounded processes that articulate with the tibia, and specifically we're also going to call these surfaces of the tibia medial and lateral condyles. So it's going to have its own medial and lateral tibial condyles, medial and lateral femoral condyles. So before we move on to the tibia, let's take a peek at this knee model. And you can see that in order to support this kind of shallow joint that seems like it wouldn't be very stable, we've added some thick cartilage pads. These are called menisci or meniscuses. We've added a bone here to help make sure this front ligament doesn't rub. We've added side tendons and internal crossing tendons, ACL, PCL, LCL, MCL. We have all sorts of fun things. And all of that is going to help make this be a joint that can actually move with function essentially like a hinge joint, pretty stable. And then down here, the joint between the tibia and the fibula is just really solidly attached. This fibula is just providing some extra structural support to the knee. So with that in place, let's go ahead and look at the tibia, which is our equivalent of the ulna, but in the leg. The ulna is, remember, following the medial side of the arm, forming the point of the elbow. The tibia is going to run along the medial side of the leg. Oh, I've lost my skeleton man. Where did I throw him? Here he is. Oh, I shouldn't pull on him there. That's going to come apart. So here you can see the femur, the tibia, the fibula, and that knee joint. And we'll talk about it in a little bit, but forming the kneecap, the patella. All right, so let's look. Oh, don't fall down, buddy. Let's look at this tibia. So again, femur, tibia, here's our tibia. And if we compare that to our ulna, again, big difference. The ulna has that socket wrench, but there's some similarities to their look. You can see like even the ends here look kind of similar. Tops look pretty different because we have very different articular surface. But let's look at this tibia. So, first important structure of the tibia, we already talked about these two condyles. Medial condyle on the inside, lateral condyle on the outside. Those articulate with the two condyles of the femur to form the knee. And instead of an intercondylar fossa or shallow, we actually have an intercondylar ridge, or specifically an intercondylar eminence. Eminence means to emanate forward, to project, basically to be a ridge. So the intercondylar eminence that to some degree nestles into that space and is going to form anchor points for the ligaments that are interior to the knee. So in particular, your ACL and your PCL, your anterior cruciate ligament and your posterior cruciate ligament are internal to the knee, and so we need some points to attach in there. So what else do we have? Well, you'll notice that the front edge of this bone is very sharp. It may be hard to see, but it's almost like a triangular front edge. So we're going to name that edge that's running along the anterior of the bone, and we call this the anterior border or the anterior margin, or in common terms, the shin. So if you bang your shin on a table, that's what you hit. And you'll notice it's very sharp, so that's part of why it, bam, hurts. Now again, part of the reason it has that shape is because of the way the muscles attach onto the bone. So one more, well actually, before we move on, let's talk about the tibial tuberosity. And that is going to be right here. So right as we come on to the tibia, right as we sit in here, we're going to be able to come down and pull on this point, this tuberosity or projection on the front of the tibia. And in fact, if we look at our model, you can actually see what's pulling. We have a important ligament attaching here. So in order to bend the knee, we have the quadriceps at the front of the leg. The quadriceps have a quadriceps tendon that attaches to this patella or kneecap. And then once we pass that patella, we have this part is called the patellar ligament. The reason this is a tendon is it connects to a muscle. Quadriceps, muscle to bone are tendons. So this is the quadriceps tendon. Bone to bone is a ligament. So kneecap to tibia, this is the patellar ligament. And this tibial tuberosity is the attachment site for the patellar ligament. So it's where your quadriceps pull on that tibia to straighten your leg, extend your leg, kick. All right, the last part we're going to talk about on this tibia is down at the bottom. And just like when we talked about the radius and the ulna, and we had the 2 points on each side, the styloid processes that formed the points of the wrist, medial and lateral. Wait, did I do that right? Sorry, lateral and medial. I have to think about which side of the hand I was on. We are going to have the fibula and the tibula each have a point that forms those bumps of the ankle. So if we come down here, and this bone is actually backwards. So this is the wrong tibia for this femur. A little bit of problem because this should be over here. So let's look at it on my smaller skeleton so we can have one that's actually arranged correctly. Here we go. So if we come along here, here we go. No, that was correct. Okay, I'm getting turned around here. So coming down here, the point on the inside, the medial side of the tibia forms that inner bump of your ankle. So I did have this right. I just confused myself. Here's your leg. This is a left leg. And as we come in, this point, the inner bump of the ankle, is called the medial malleolus, medial malleolus, or you could call it the tibial malleolus. What does malleolus mean? Well, when we had these 2 points, they were the styloid processes, and they came from the word stylus, meaning a writing utensil, because they looked like the point of a pen. These guys are called malleolus, and that comes from the word mallet, because they look like a hammer. And it looks like you could use your ankle bone to do some hammering. So last bone of the leg, before we move on to the foot and ankle, is our fibula. If we compare this to the tibia, it's a very delicate bone. It looks a lot different than the radius, and it's going to sit right in. Oh, that's not the right way. Right in against this tibia, like this. So let's look at this on our skeleton, where they're going to fit a little better since they're the right bones for each other. You can see we connect here to the top of the tibia, and we come down here, the bottom of the tibia, we have our medial malleolus, and I bet you can guess what this one is, the lateral malleolus. So what are the key features I want you to know for the fibula? Well, at the top, we have a head, just like we have the head of the radius, we have the head of the tibula. This is the proximal rounded end, and it articulates with the proximal tibula. They kind of sit right together in here. Maybe a little more like that. At the bottom, this point is the lateral malleolus, the outside point of your ankle. So you can reach down there and feel it. That's what I'm doing right now. That is most of the bones of the leg. There's one I left out, little tiny bone. And sometimes when I show students this bone out of context, they go, what the heck is this? What could this be? How could this be a leg bone? This is your kneecap. Your kneecap is also called your patella, and it's sitting, ouch, my skeleton stabbed me. It's sitting right up at the front of the knee, forming its own set of synovial joints with the knee, and also helping to make sure that that ligament and tendon that's crossing over isn't rubbing and isn't getting pinched every time you walk around on your knees or do anything like that. So again, to show our guy here, this is called a sesamoid bone because it's internal to a tendon. It literally forms inside this tendon here. And so it sits right there, and as the knee bends, It helps to provide a joint that can be a synovial joint that moves smoothly across the front of that femur. All right. One more important set of bones. These should be very familiar because they're very similar to these. So your hand and foot are structurally fairly similar, but here's the foot, here's the hands, but they've also got some unique properties. The foot, as you can see, in particular, these ankle bones are restructured to help make sure the foot can stand and provide a lot of strength this way. So in your wrist, we have the carpals. In your ankle, we have the tarsal bones. And there are 7 tarsal bones as opposed to the 8 carpal bones. Now, unlike with the carpal bones where I said just know how many there are, I am going to ask you to learn 2 important tarsal bones. And that's going to be the bone that forms the articulation point with the tibia and this bone here that forms your heel. So this bone up here that articulates really smoothly with the tibia in a little hinge, sort of modified hinge joint. This is the talus. And the word talus comes from the same word as talon, the toes of a hawk. This is the talus up here at the top of the foot, articulating with the tibia. This big bone back here that juts back is the calcaneus, which literally means the heel, or the big calcified bone of the foot. And you notice that all together, we wind up having this arch on the bottom that provides that flexing and support in the foot. The rest of these bones, now that we've passed the tarsals, we have, rather than the carpals go to metacarpals, tarsals go to metatarsals. These form the body of your foot. So this is still the body of your foot. And then these, from here on, are your toes, your digits of your foot. These are going to be phalanges, again, just like the phalanges in the finger. And so just like in the fingers, we number them from big toe to little toe, 1, 2, 3, 4, 5. And we say that we have a proximal phalange, a medial phalange, and a distal phalange. Every digit except the big toe has 3. The big toe is missing the middle phalange. It only has 2. All right, and that, folks, gets us through the bones of the lower extremity. So I look forward to talking with you next about the muscles of the lower extremities. Thanks for listening.